Okay, so I am like a total nerd. I used to work for a Blue Cross Blue Shield plan, so I'm like fascinated by innovation in like payment model.
Okay.
And I love what you guys are doing that's like helping employers understand where their healthcare costs are going. And I think like right now, in an era where like big companies like Walmart, Amazon, and like Berkshire Hathaway have like decided like screw it, we're just gonna do this ourselves.
Yes.
I think what you guys are doing is very interesting. So for those who are looking, explain what you guys do and how it works.
So, while Walmart is really exciting big, but the middle market self-insured employers,
Yeah.
they're taking the same risk. These 250 employees to 10,000 odd employee companies have no way of knowing what is driving their healthcare costs, what actions to put in place in, benefits-wise and other things, how to actually track these programs and solutions, and then fundamentally how to actually communicate in a way that gets you to use the right programs and service and benefits and use the right place of care, which actually drives up most of the costs.
This is such like an unmet need. Like I can't even tell you guys enough. Like from my health plan years, this is like those small mid-sized employer groups really struggle with understanding what they're spending their money on, how they can bring their costs down, and then they've got to as soon as they figure it out, re-sign and do it again the following year.
Oh, yeah.
So talk to me, I guess, about what you guys are looking at and how you're helping make sense of the cost of health insurance for one of those employers in that employee range that you mentioned.
So, what we do actually is we take all the healthcare data, medical claims, pharmacy claims, biometric screening data. We also onboard the employees so we understand their profiles too. And by mapping it against all the other kind of cost drivers, we're able to see, is this employer got high emergency room visits, as we're seeing in Massachusetts, it's a big issue. Or does this employer have a huge issue of they're overpaying for pharmacy benefits? Or do they have an issue of people actually going to expensive places of care? Or do they have an issue that chronic conditions are driving? Which one thing, because they can only do one thing, is really the biggest issue they should tackle? And we're able to map it out very quickly in a very visual storytelling tool.
Okay. How hard is it to get that initial data in to the Zakipoint system?
So we have a lot of experience. My co-founder actually comes from this space. He's actually worked for companies like Walmart and others. Just this week, we went live with one of our customers. It took us 4 weeks. It was with Harvard Pilgrim. It took us 4 weeks to go live.
Okay, so 4 weeks to go live, and they've got all their information in there, and then they can get this dashboard look at where their cost is going.
Correct.
And then what do you provide on top of that? Do you provide consultation? Because that's we always talk about that in healthcare, great, we've got all this data, and now I don't know what to do with it. So are you providing recommendations on what they should do?
So I come from a data science world. I actually spent many years building these models for Coca-Cola, Heineken's of the world, basically getting you guys to drink a lot more Coke and Heineken. So I kind of felt ill doing that. The reason it's relevant here is we actually provide the tools, the simulation tools, the solutions that are embedded. We help the benefit consultant to be the consultant, to be the hero here.
Okay.
So that's kind of how we are embedding our analytics simulation technology to help the benefit consultant.
Okay, so is that your market then that you're selling to, is the benefits consultants?
Correct.
Got it, okay.
Correct.
And then tell me, I guess, a little bit about where you guys are at from a company standpoint. You are here with MassChallenge, so what are you looking for from this experience?
Sure. So I think it takes almost a village to really build a truly impactful company to go out and take what we are doing. At the moment, we're doing it for about 110 employers. We are profitable. We think we can
110 employers.
Correct.
Okay, great.
We can grow 3x over the next 12 months. But in order to really go out and have a major impact, we want to be able to work with some bigger partners, benefit consulting, third-party administrators. So MassChallenge really helps us to push the envelope of the size of companies and partners we can work with, but also to push the innovation around member engagement that we are really embedding into what is the one thing.
Oh God, the member engagement. That's like a black hole. Tell me how.
I used the wrong word. I shouldn't say member engagement.
You should never have said that. You should never have said that.
Rewind. Okay, what I really mean is we know what's the one thing, and I read this book called One Thing. You should all read it. What is the one thing you should do? And it might be relevant for somebody else. It might be something else. We basically focus on getting that message out to you in a way that actually motivates you to take the change. So
Okay.
we're not about engaging you in the,
in the way
everything
that
in it.
you want to be. Just talk to Bruce from Frame Health. See what you guys can do together. No, I mean, quite honestly, I mean, like, so the member engagement part of this is key, because it's not just like member engagement. It's like utilization of benefits. So it's
Yes.
actually like for an employee in the company to use their health benefits that their employer is already paying for.
Absolutely.
And that, ends up actually making the whole thing worthwhile. right?
Simplifying it, bringing it in one place, and personalizing it.
Okay, very good.
Yeah.
So last question for you, because Natalie is walking up right behind you.
Oh, really?
Okay. So again, tell me what it is. Like, where are you guys at right now? Have you raised money? Are you a Series A? Like, where are you at? Give us a little bit of an
So
insight
we've
there.
raised a little bit of money, but we are getting to the Series A kind of round. By this summer, we'll be raising $3 million then. We are profitable, but we really want to take it to the next level.
And how much are you helping employers save, real quick?
About 2 to 3%.
About 2 to 3% on their healthcare costs.
Correct.
Okay, year over year, or just like it's a
so-
one big two
So
to 3%?
over an 18-month period that we are seeing that kind of level of cost
Okay.
containment.
Awesome. Great. Well,
Great.
that's exciting. I look forward to seeing what happens with you
Thank
guys.
you.
Thank you so much for joining me. It's a pleasure to speak with you.
Thank you very much,
Thank
Jessica.
you.
Cheers.